Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Bryan Cheever of Hamilton Family Medicine Clinic. Dr. Cheever is a board-certified family medicine physician at Hamilton Family Medicine Clinic, a new practice inside of Hamilton Physician Group Murray campus at 800 GI Maddox Parkway in Chatsworth. Dr. Cheever is also the program director of Hamilton's Family Medicine Residency Program. Dr. Cheever completed his medical training at the University of Tennessee College of Medicine and his internship and residency at Florida Hospital. He treats adults and children age 2 and up. Dr. Cheever, today we're going to be talking about walking as well as Hamilton Family Medicine Clinic. Let's start off with walking. Now, I understand how important that walking can be, but what exactly is the health benefits when it comes to walking? It just makes me feel better.
Yeah, so a lot of people think that you have to run or jog and do strenuous activity, but even just walking is a great health benefit. It helps the circulation. It's good for the mood, the mental. It's good to help with weight management, weight control, as well as your respiratory functioning, and in fact, in the last week, I read articles that said that even people who exercise strenuously several days a week, if they add on more of a moderate, like walking or hiking, they get an added as much as 30% longevity and health benefit.
But now, those of us who do not do strenuous exercising, that is still great.
Still get a good benefit by walking. The other thing is, I just read an article yesterday, in fact, that said that sitting increases your mortality and your health risk. So just getting up and walking several times a day can make a big difference. So people even that go to a gym and work out hard, but spend the rest of the day sitting, still have health risks. Whereas if you get up every 30 minutes to an hour or two and walk around, you get health benefit. It lowers the CRP, an inflammatory marker. It helps with the overall physical and wellness and longevity. And so the studies came out, showed sitting worsens your longevity. So therefore walking, staying active, getting up even in your house can be beneficial.
What about places to walk? What are some good places in our area?
Yeah, so we are blessed in this area with a lot of places for walking. So when you look at that, we've got indoor gyms that are great, but you don't need gyms. We got great neighborhoods. We got neighborhoods. When I drive to work and go home, I'm seeing people walking all the time. There are a lot of places that have great sidewalks, great safe places to walk. The local communities have many schools that have tracks that people can walk on. You have community park and recreation centers such as Civitan Park on Shugart. You've got Hague Mill Park Lake, which is a great hiking place. Heritage Point has walking places. Edwards Park up Cleveland Highway has a walking trail. The new Riverside Park has walking trails.
Oh, yeah, that's beautiful.
Yeah, we are blessed with a bunch of outdoor trails. So the Disney Trail, actually one of the most strenuous in the state and steepest, but it's a great trail. The Dalton State College Trail System
that's nice over there.
They got several trails there.
Yeah.
I've hiked that many times, beautiful trails. The new Rocky Face Ridge Park has great trails, and you can pick what you want. They've got a 10-mile loop that's a biking, but you can also walk, and it's a 1,000-acre park that now has bathroom facilities, picnic facilities, just a great walking place. Mount Rachel, there's a trail on Mount Rachel.
Well, what about the best time of day that you've found to walk?
So obviously the best time to walk is when it's safe. So you want to do it when it's not necessarily overly cold or rainy or bad weather, but if you do, be prepared. Take gear that can, if you know you're going to be out for a while. So I'll take a raincoat or gear if I need, or if it's cold, then I'll dress appropriately. Night and day, it's nicer to do it during the day. So evening and morning are oftentimes the best. Depending on where you're going to walk, you want to make sure that you're visible. So if it's in the dark, you want to make sure you've got clothing that can be seen. If it's in the hunting season, you want to try to stay away from places where people hunt and wear bright clothes if you're out in the woods, things like that. So just do it safely and whatever's convenient. So depends on your ability as far as where's the easiest and best to do it and to do it safely.
So as we wrap up the walking segment of the program, anything else you want to mention about walking?
The only thing I want to leave as a word of advice is those who walk together, talk together. So it's great for relationships. It's great for family and friends to develop those relationships by spending time together.
Those who walk together, talk together. I like that. Very good. Thank you very much. Let's move on to your practice over at Hamilton Family Medicine Clinic. Now, why is that different from other physician practices?
So Hamilton Family Medicine Clinic is a new physician practice where we use resident physicians to help provide comprehensive medical care alongside board-certified family physicians. And whether you need it for medical care for common illnesses or complex chronic conditions, we take time as our team to actually provide the care that's needed and also a learning opportunity for the patients and for the residents.
Well, you're talking about residents. Are those real doctors?
Yes, they are. Residents are doctors. They are graduated from medical school, and they either are MD or DO degreed, and now they're training to be a particular type of doctor, just like you would a pediatrician or a surgeon or something like that. Ours are trained to be family physicians, to care for the whole family and provide a broad, comprehensive care.
So Hamilton is a teaching hospital. That's what you're saying?
Yes. Hamilton Healthcare System is now an academic institution as well as just a patient care and community care facility.
What services are provided at Hamilton Family Medicine Clinic?
So we treat patients 2 years old and up typically. We also care for the whole family, so that's why it's family medicine. It's the whole family. Services include we do annual physical exams, we do diabetes care, we do geriatric care. For older people, we do high blood pressure and cholesterol management. We manage depression and anxiety and mood disorders, arthritis and pain, respiratory infections, respiratory illnesses like COPD and asthma, minor surgical procedures, particularly dermatology, skin conditions, and then we do on-site lab and x-ray.
Well, I was going to mention x-ray. That's very important. That's on-site.
Correct.
And that on-site lab is so important, too.
Yes.
Wow. Thank you so much. For more information about Hamilton Family Medicine Clinic, you can call this number, 706-686-8015, or visit hamiltonhealth.com/family. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.